Facility of the Year Award. Jim Tolliver Community Mental Health Center.
The staff have worked very hard. We have worked very hard in the past in general, but especially over this past year, we've made a point to try to make our own little scenario of having this is the place to come to work, as well as the place to come for services. I challenged the management staff, and they took it, rolled their sleeves up, took it and ran with it, partaking in tons of different community events and coalitions and boards. And that's every area, inpatient, outpatient, wherever you're at.
Everybody that walks in is hurting, and I truly believe that the one thing that links us all together is pain, and it's just a matter, we choose different ways to mask it so we don't have to think and we don't have to feel. It's an honor and a privilege to be able to share hope with people that they don't have to stay stuck that way.
Central Oklahoma Community Mental Health Center.
Can I just say I'm really excited that Central Oklahoma is the finalist for Facility of the Year. This is the best place to work in the state. I'm sorry, the other facilities, but this is a great place to work, and we've just done some phenomenal changes around here over the past year and a half. Even if we aren't chosen for the award, it was really great process to document everything that's happened over the past year and a half, and how we feel like, you know, we're stronger and we're just moving forward together.
Oklahoma Forensic Center.
OFC has done a tremendous job, all the employees here, working together to meet demands for forensic psychiatric treatment across the state. So for the last year and a half, we've been working hard to reduce the number of people on our waiting list. And about December of last year, we actually eliminated our male waiting list for a period of time. And right now we average about 10 to 15 people on an average daily basis on a waiting list, which is tremendous. We went from 130 plus down to 10 or 15. People wait in jail on average about 2 weeks before they come to us, 2 to 3 weeks. We're able to treat them and move them through our system quicker. We couldn't do that without just a tremendous amount of work by the staff at OFC, working together, working hard to accomplish the goal. I believe, you know, we're an outstanding facility, and if not the best in the state. So I'm very proud of the staff here.
Tulsa Center for Behavioral Health.
I've worked at TCBH now for 10, going on 11 years. I think it's a great facility. I think it's a vital part of the mental health community in Tulsa. The need seems to keep growing over the years, and we have had to always be focused on efficiency and effectiveness, using best practice techniques to get us the best results with the resources we have. I have great staff. I have a breadth of experience at TCBH. They're committed people who come to work every day ready to do a good job. We deal with a lot of consumers who are very much marginalized in our community, and we try our very best to always treat people with respect, give them our best every day. And I get up every day happy to go to work. I work at a great place. I work with great people. I think that we do a wonderful job, always trying to do our best and always trying to be the best we can for Tulsa.
Northwest Center for Behavioral Health, Alva Fairview Satellite.
Northwest Center for Behavioral Health, I'm so proud of them, the way they represent what we're trying to do to take care of people in need.
For Alva and Fairview, that stands out. Not that all of our outpatient sites don't do a good job and a great job, and especially with our resources in rural Oklahoma. When you go there, there's always the professional atmosphere. There's always people busy. You know, I tend to look at that as executive director when I go out. The people that we have and the people that we're serving, they're always so supportive with all of our support services that go out, whether it's being in compliance with fire code and safety issues to involvement. They have such positive and promoting mental health and substance abuse out there in the field.
Oklahoma Crisis Recovery Unit.
One of the reasons I recommended OCRU for Facility of the Year is because, we just got a lot of our numbers back. This past year, we had 76% of the people that we provided services for were involuntary. In amongst that 76% involuntary, with our customer satisfaction rate, we've got about an 84% positive. And it's not like we had just 5 people fill it out. That's with like almost an 80% completion rate too. Last time we had a 92% staff satisfaction rate. Our last provider audit certification gave us special distinction, which is one of the highest awards that the provider cert delivers out when they give a certification. So you've got a decrease in the negative things, you've got a positive report by your consumers, and you've got a positive report by the staff, and then your auditing body gives you the highest level of certification they can provide. I think that would sum up why we nominated ourselves.
Griffin Memorial Hospital.
And I think one of the things that stands out the most to me since I've been here is the leadership of our executive director, Lori Jordan. One of the things that she said right off the top was that she wanted patient safety, quality services, and she wanted the staff to feel safe. In the new reorganization that she had actually brought up to us and said this is how she wanted it to work, a lot of naysayers, a lot of people said it couldn't be done. But when we sat down and got it on paper, what we found is not only did it work, but the results weren't just average, they were spectacular.
Through all these changes that Griffin has made in the last year, over the last year, a little bit plus, we've also enhanced our community relationships with the local hospital and other community vendors through various means, and basically relationship building. That has just enhanced our overall commitment to Griffin and its mission. They've produced a better outcome as far as a product and a service, and definitely in a community in that which is Griffin Memorial Hospital.